Hello and good afternoon from the Brazos County Health District. Thank you all for being with us today. As of today, May 26, we have 444 cases total. That is an additional 3 cases from yesterday. Total number of recovered at 175. That leaves 250 active cases. Brazos County residents currently hospitalized at 5. 0 have been discharged from the hospital in the past 24 hours. Total number of deaths at 19. That is 1 up from the last time that we were together. This is a female in her 80s. This was on May 23rd. Total number of tests today, 7,085. 7,085. As staff and residents of local long-term care facilities are being tested for COVID-19, we do expect an increase in the positive numbers of cases that we will be seeing over the next several weeks. This is part of a statewide initiative to increase testing among vulnerable populations we have discussed before. Local testing by health care providers has also increased. So we do expect to see total number of tests performed to continue to increase as well. Anyone, again, experiencing COVID-19 symptoms, fever, coughing, shortness of breath, is encouraged to get tested. Knowing whether or not you are positive for COVID-19 does assist with contact tracing and preventing the further spread of the virus. Previously, we've talked about boxing it in. We talked about how important it is to identify where the cases are and who has been around that case so that we can quarantine and we can keep it boxed in. And that is all part of this initiative, is testing and how important testing is. Park at Traditions, many of you read this weekend, released a statement on Saturday, May 23rd, that all of their residents and associates were tested for COVID-19 on Tuesday, May 19th. I should mention Park at Traditions was not part of the long-term care facility initiative from the state. They did this on their own volition as an assisted living facility. Out of the 191 tests performed, 45 were positive. This is 34 residents. This is 11 associates. The Health District continues to communicate with the facility on a regular basis, and their transparency about testing, about positive cases with the general public is greatly appreciated. The way that Park at Traditions has conducted themselves. And again, they've been very open with us. We continue to work with Park at Traditions. As a matter of fact, the state does as well, and so we continue to keep you updated on that situation moving forward. Positivity rates. What is a positivity rate? This is how many positive cases we have, positive tests we have, over how many tests are performed. This we call the positivity rate. As more tests are performed, we expect that rate to go down. We want to see that, I can say, moving forward. That means that we are testing enough. Our rates here are, as of April 5th, we're 6.3%. We dropped down to 5.5% May 5th. As of May 26th, our most recent numbers are about 6.3%. More broadly in Texas, we're right about that. So we're running right about average for Texas, about 6% or so. So this would be, of the tests performed, 6% are positive. What we'd like to see moving forward is that number drop. That means that we're doing more tests and having more negatives on the tests that we're doing. Sanderson Farms. So there have been 41 total positive cases to date at Sanderson Farms. 27 of these cases are considered active. The Health District continues to communicate with the administration on guidance and education. And Sanderson Farms is also working with the state. We are part of that conversation to provide testing for all employees. That is ongoing as we speak. About asymptomatic cases. So a person is considered to be asymptomatic, have no symptoms at all, if they test positive and don't have any symptoms. We consider someone pre-symptomatic if they test positive, don't have symptoms, but then go on to develop symptoms. We call that pre-symptomatic. And then we call someone symptomatic if they present with symptoms and then test and are positive. Those are the terms that you will hear being used by our epidemiologists. Asymptomatic persons we know can transmit the virus. And that is why it's important for folks who are out and about to be wearing face masks, to be practicing social distancing, as we have discussed previously. Although it is not known for certain, it is assumed that asymptomatic persons will go on to develop antibodies. that will offer some protection from reinfection. A lot of interest in this area that is ongoing moving forward. It is difficult, obviously, to determine how widespread asymptomatic COVID-19 is because they're asymptomatic. So the idea here really is that, again, we go back to our boxing it in concept here, that if we have a positive case, we try to find the individuals who would be around this positive case and get that testing done. And it's with that testing that we can identify those who do not yet have symptoms, but who are at risk of transmitting the virus. We know the virus is here. We know the virus continues to transmit through our community, and we are intensely interested in finding where it is. And that is why we've been talking so much about testing in recent press conferences, and we'll continue to talk about it. We need to find where it is, and we need to find who could be at risk for getting the virus and then unknowingly spreading the virus to others. Operation Restart. Operation Recovery Ready kits are available, remain available for businesses who have taken the pledge to protect their employees and customers from COVID-19. Businesses can visit www.brazoshealth.org to take the pledge and sign up for a Recovery Ready kit. This includes digital logos, a window decal, a yard sign, and a placard. This is what you're looking for out and about. These are individuals who have taken the kit and are doing everything that they can do to keep their customers and employees healthy. So thank you to all those who have taken the pledge and are proudly displaying the proof that you have done so. The Operation Restart team and the Health District encourages you to take your business where you feel safe. We've talked about that in previous press conferences. So we know what social distancing looks like. We know what hand sanitizer is. And we know when employees are wearing masks and when we feel safe. And so we can look around and we can make good decisions for ourselves and for our family. COVID-19 Conversations, the Texas A&M School of Public Health is presenting a video series called COVID-19 Conversations beginning Thursday, May 28th. This will be between 12 and 1:30 p.m. So some great information here. Topics include contact tracing, this idea that we've been discussing here, modeling. We've talked about modeling before, so some more in-depth information about what that looks like and what that means moving forward. And then the role of epidemiologists. Some of the PPE, so the personal protective equipment. Been a lot of information about the personal protective equipment shortages for this and the ways to properly wear that, the do's and don'ts of PPE, and then how older adults can be wiser about COVID-19. So this video series can be registered on www.brazoshealth.org. The Collegiate Summer Baseball Invitational. This will be taking place in Brazos County the week of June 1st. The organizers of this tournament have received approval from the state, and they should be commended for their diligence in doing this. I've been in touch with the organizers of this invitational, Mr. Giva, and they've done a great job of being very diligent here and persevering and ensuring that they are doing what they can to protect their athletes and then protect anyone else who would be at the stadium during those times. So testing, again, players, coaches, umpires, broadcast team, all getting testing, monitoring participants daily for symptoms, isolating all participants at a local hotel for the entire week, not allowing fans to be present. They'll be videoed. And so a lot of work that they have done, and again, thank you for doing it the right way. And that's the spirit of the post-COVID-19 world of saying, okay, we're going to go about and do things that we want to do, but we're going to do it safely. And that is what this is demonstrating. And so thank you to those organizers. So